these are modulators. Modulators are things that help to center. It's not going to shift it one way or another. It's sort of like, I don't know, maybe a little bit like adaptogens. It just takes the situation and tries to make it better centered. Things that we can use here are probiotics. Vitamin A and E have big immune benefits. Colostrum, IgG proteins are great to help with the immune system, and also great to help repair the intestinal barriers. Anti-inflammatory botanicals, boswellia and turmeric, and proteolytic enzymes, which are inflammation-eating enzymes, all help to modulate the immune responses. So the functional model is identify the current circumstances. That is about where traditional medicine stops with autoimmune conditions, because they don't really have anything to treat. Then we ask, how can you return to health? That's an innovative question right there. And in my book, I talk about how medicine asks, how can we manage this situation? And functional medicine says, how can we return to a state of health? We have to investigate the road to the circumstances, which means looking at the functional shifts in hormones, looking at the functional shifts in your immune system. We have to test them. Like I said on a couple of the markers, there's no indication that you have them other than testing. The only indication is a disease process. And by the time we get to a disease process, there are so many things going on that you can't make assumptions. You need to test those things so you know what you're treating, and then you treat exactly what you find. If it's high on the B cell, if it's high suppressor cell, if it's low helper cell, whatever it might be, we have to start to modulate those things, start to change them back, and we have to retest it to see if it's working. And sometimes on our first retest, we have to make some adjustments and try a little bit different, adjust the regimen a little bit, and we got a little bit too much of this and a little bit too little of that, so let's make some changes and retest. And that's the model for everything we do, is test, treat, and retest, and then expect the body to heal. Once balanced, we can have faith that the body can restore function. The damage can be repaired in most situations. I have a faith that can happen. And then, really we can bring this all into a growth process, a growth and healing process. So once survival is evident for your system, for your body and brain, you can begin a movement towards what you really desire and a passion for life. And I put this in here because to me, that's kind of motivating. You're no longer focused on this symptom, this condition. It doesn't take the energy of your life. And now you can look for connection, for passion. You can utilize the energy that you now have in abundance. And I can guarantee you that if we can stop an autoimmune process, you'll be overwhelmed with energy because it's stressful. It's crushing to your metabolism to have an autoimmune process go